This show is brought to you by the Veterinary Cardio Club. Master veterinary cardiology without leaving your practice. Get continuous mentorship from specialists in veterinary cardiology, real case discussions, and structured learning built for clinicians who want to improve, not just consume content. To sign up for a free 7-day pass.
Hi everyone, I'm Dr. Laurent Locquet, a board-certified veterinary cardiologist and the founder of the Veterinary Cardiology Club. I'm passionate about helping veterinarians and future students feel more confident when it comes to cardiology. One of the things I love most about teaching is taking topics that can seem complicated, like heart failure, arrhythmias, and cardiac medications, and breaking them down into concepts that are practical and easy to apply in everyday practice. Because once you understand the mechanism behind these drugs, cardiology becomes a lot less intimidating. Let's get started. One of the biggest mistakes people make when learning cardiology is trying to memorize drug names. Instead, focus on physiology. Ask yourself, what is the heart struggling to do? Does it need to pump better? Is there too much fluid? Is the heart beating too fast? Once you understand the problem, the medication choice becomes much more logical. So let's walk through 5 of the most common cardiac drugs and, more importantly, how they actually work. The first one, Pimobendan, helping the heart pump smarter. So Pimobendan is often considered the cornerstone medication for many dogs with heart disease. It's classified as an inodilator, meaning it improves both the contractility whilst also causing vasodilation. Its first mechanism is calcium sensitization. Rather than increasing the amount of calcium inside the heart cell, Pimobendan makes the contractile proteins more sensitive to the calcium that's already there. And this allows the heart muscle to contract more efficiently. Its second mechanism is phosphodiesterase 3 inhibition, which leads to vasodilation. As the blood vessels relax, the heart doesn't have to work as hard to eject blood. So Pimobendan therefore helps in 2 ways: stronger contractions and less resistance to pump against. So as a clinical example, a Doberman with DCM, which stands for dilated cardiomyopathy, has a very weak and enlarged heart. The Pimobendan can help improve the cardiac output and can significantly improve the quality of life. So the key takeaway is better squeeze, less work. The second one is furosemide. Removing fluid fast, furosemide is the drug we most commonly reach for when a patient is drowning in its own fluid because of congestive heart failure. Furosemide is what we call a loop diuretic that acts in the ascending loop of Henle in the kidney. Normally, this part of the kidney reabsorbs the sodium, the chloride, and the water back into the circulation. But furosemide blocks that process. And as sodium stays in the urine, water follows outside of the body. The result, an increased urine production, reduced blood volume, less pressure in the pulmonary circulation, and therefore reduced pulmonary edema. So as a clinical example is when we have a Cavalier King Charles Spaniel representing with severe respiratory distress from left-sided congestive heart failure. What can we do? Well, furosemide can rapidly decrease the fluid accumulation in the lungs and helps the dog to breathe more comfortably. So the key takeaway is, if fluid is the problem, furosemide is often the answer. Third one is benazepril, blocking the body's stress response in heart failure. It isn't just a problem of a weak heart. The body responds by activating hormonal systems, especially the renin, angiotensin, aldosterone system, also known as the RACE system. One of the major hormones produced is angiotensin 2, which causes blood vessels to constrict and promote fluid retention. So benazepril is an ACE inhibitor. It blocks the enzyme that is responsible for converting angiotensin 1 into 2. And therefore you'll have less angiotensin 2, which means less vasoconstriction, lower blood pressure, a reduced afterload, reduced preload, and less activation of harmful remodeling pathways. And therefore, in simple terms, benazepril reduces the workload that is placed on the heart. As a clinical example, when you have a dog with chronic mitral valve disease that is stable but showing signs of heart enlargement, benazepril might help to reduce the neurohormonal response that contributes to the disease progression. So key takeaway, block the hormones that make heart failure worse. Okay, on to number 4, spironolactone. Fighting aldosterone. Spironolactone is often called a potassium-sparing diuretic, but its most important role in cardiology may actually be its anti-aldosterone effect. Aldosterone tells the kidneys to retain sodium and water, and in chronic heart disease, aldosterone levels often remain elevated, contributing to fluid retention, fibrosis, and cardiac remodeling. Progressive heart damage is exacerbated as well, and therefore spironolactone blocks aldosterone receptors, which helps to prevent the sodium retention whilst also reducing some of the long-term harmful effects of excessive aldosterone activation. And unlike furosemide, it has relatively weak diuretic effects on its own, so it's commonly used as a part of the combination therapy. So as a clinical example, a dog with chronic congestive heart failure is already receiving furosemide and Pimobendan, for example, and then spironolactone is added to provide additional neurohormonal control and helps to manage fluid retention. So the key takeaway is protect the heart from the damaging effects of aldosterone. Last but not least, digoxin, slowing down the heart while supporting the contraction. Digoxin is one of the oldest cardiac medications we still use today. Its primary target is the sodium-potassium ATPase pump located on the cardiac cells. And when this pump is inhibited, intracellular calcium levels increase. More calcium means stronger myocardial contraction, which creates a positive inotropic effect. But in veterinary cardiology, digoxin is often used because of its effect on the electrical system. Digoxin increases the vagal tone, which slows down the conduction through the AV node. That makes it particularly useful for controlling ventricular rates in, for example, dogs with atrial fibrillation. As a clinical example, a Great Dane with atrial fibrillation that has a heart rate of 220 beats, for example, the digoxin may help to slow down the AV nodal conduction and improve the rate control, allowing the heart to function more efficiently. So as a key takeaway, slow the rhythm and improve the efficiency. So to summarize everything, when you're trying to understand cardiac drugs, think about the physiological problem you're solving. First of all, Pimobendan. It improves the contractility and causes vasodilation. Furosemide removes excessive fluid by blocking sodium and water reabsorption. Benazepril blocks the angiotensin II production and reduces the cardiac workload. Spironolactone blocks the aldosterone and limits harmful remodeling. And then digoxin slows down the AV nodal conduction whilst supporting contractility. So if you understand these mechanisms, you're no longer memorizing drugs. You're understanding cardiology. Cardiology is fun, and there's always way more to learn. For more practical cardiology tips, board-style questions, case discussions, and downloadable cheat sheets, check out the Veterinary Cardiology Club. It's a global community of veterinarians receiving direct mentoring from diplomates in veterinary cardiology and international experts every day. Use the code Vet Candy and get a free week of cardio learning with our club. See the notes below for the link and more details, and I hope to see you there. Goodbye.